Hello and welcome to the fourth lecture of PYQ series Obstetrics and Gynecology, mainly for PDCET Obs students, and you can subscribe this channel on YouTube for more such videos. So quickly coming to the first topic, contraceptive failure rates in different tier of contraception. So in first tier contraception, failure rate is minimum, that is less than 2%, and the examples are IUCD implants, sterilization techniques. In second tier it's 4 to 10%, hormonal patches and rings. In third tier failure rate is around 10 to 20%. Examples are barrier methods and awareness method. And in fourth tier failure rate is 21 to 30%, and examples are spermicides. So you have to remember the level of the tier of contraception and the failure rate. So this can be asked in MCQ. So a question, microporous synthetic mesh, that is the type of synthetic mesh when the pore size is less than how much, then it is defined as microporous. So pore size less than 10 micron, then it is defined as microporous synthetic mesh which is used. So macroporous size more than 75 micron, microporous less than 10 micron, and submicron is less than 1 micron. So macro, micro and sub. So remember these values. Now risk factors for fibroids. The risk factors are nulliparity, obesity, hyperestrogenic state in black race, and protective factors are multiparity and smoking. So this can be easily asked in MCQ. Now most common type of breech presentation: complete breech, frank breech, footling, or all have similar incidence. Just try to guess the answer. So the answer is B, that is frank breech. Now type of breech presentation: complete and incomplete. In the incomplete type, different various classifications: frank breech, footling breech, and knee breech. And so frank breech is found in around 70% of the breech cases. So the most common breech presentation is frank. Now, tocolytic of choice in a patient with heart disease: indomethacin, atosibane, magnesium sulfate, terbutaline. Everyone should guess the answer before going to the next slide. So the answer is atosibane. So just remember this, the tocolytic of choice in patient with heart disease is atosibane. Case-based question: 34-year-old G2P1L1 at 35-week pregnancy presents with leaking PV. Sample of discharge turned red litmus blue and furning was present. Temperature was around 102 degree Fahrenheit and pulse was 106 per minute. So next step of management would be what? Administer betamethasone, administer antibiotics and induce labor, administer tocolytic agents, or place cervical circlage. So let's go through this question and see the clinical findings. And these findings are suggestive of chorioamnionitis. So the answer is B, that is administer antibiotics and induce labor. So management of chorioamnionitis at any age is delivery of fetus regardless of the gestational age. Now infection can lead to recurrent abortion. Which of the infection can lead to recurrent abortion? Toxoplasma, CMV, herpes, or syphilis? Answer is syphilis. Syphilis leads to recurrent abortion. Remember this important term, recurrent. Okay, when recurrent abortions is asked, then syphilis can lead to recurrent abortion. WHO criteria for semen analysis: many MCQs can be formed. So the volume should be 1.5 ml, pH 7.2 to 7.8, viscosity less than 3 on a scale of 0 to 4. Concentration of sperm should be more than equal to 15 million per ml. Total sperm count more than equal to 39 million per ejaculate. Mortality should be more than 40% with 32% progressive mortality. MCQs have been formed in previous years with each of these points. Normal forms 4%. This is the strict criteria that normal forms should be minimum 4%. And vitality more than equal to 58%, WBC less than 1 million per ml, and round cells less than 5 million per ml. So all of these are important, but mainly the concentration, sperm count, mortality, and normal forms and vitality. At least remember these. Now the commonest site of infection of genital tuberculosis: cervix, fallopian tubes, vagina, or endometrium. So the answer is B, that is fallopian tube. So site of infection in genital TB most common is fallopian tubes. Diagnostic criteria for primary abdominal pregnancy. What is the diagnostic criteria for primary abdominal pregnancy? Rubin's criteria, Studiford, Wrigley, or all of the above? Answer is Studiford criteria. So for primary abdominal pregnancy, it is Studiford criteria, and for ectopic ovarian pregnancy, it is Spilsberg criteria. Now a table with tumor markers, few important ones: ovarian tumors and their markers. Epithelial ovarian tumor, CA125, CA199, and CEA. Endodermal sinus tumor, remember AFP. Embryonal carcinoma, AFP and HCG. Mature teratoma, it's AFP again, and granulosa cell tumor is inhibin. So very important table, and you can find at least one MCQ from this table in any of the competitive exams. Now 5-year survival rate of carcinoma cervix: According to FIGO staging and 5-year survival rate, stage 1 it's more than 90%, 2A it's more than 80, 2B 65, 3A 45, 3B 35, and grade 4 it's 15%. So remember at least grade 4 and grade 3, around 35 to 45% grade 3 and less than 15% in grade 4. Drug that inhibits uterine contractility and causes pulmonary edema. So it inhibits the uterine contractility and also causes pulmonary edema. Ritodrine, nifedipine, indomethacin or atosibane. So answer is A, that is ritodrine. And tocolytic of choice in heart disease patient was atosibane. Most common cause of infertility: male factor, female factor, combined or unexplained. So answer is B, that is female factor. And remember these few important percentage: male factor 30 to 40%, female factor is 40 to 50, combined 10, and unexplained in 10. So female factor is the most common cause for infertility. So thank you very much for your patience, and you can subscribe this channel and share with your friends or colleagues for more such videos. Thank you.